Welcome back. Today's video can be a bit long. I'm here to give you a complete guide of how to choose a branch for your PG. Stick to the last. If you stick to the last, I can assure you that you'll get a clarity about how to go about choosing the branch for your PG counseling. So here we go. The first step, we'll divide this video obviously into whether you want clinical or you want a non-clinical paraclinical subject, okay? And how you're going to decide that. That is going to be the first step and the most important step. Now, clinical or paraclinical is something goes way back to your interests. If you are someone who already has a definite or definitive interest towards a clinical branch, that you want to be a surgeon, you want to be MD medicine, then it's clear this video is definitely not for you. You're already clear in your head. Now, if you already have clarity, then it's fine. If you don't, then we have to go a little bit back during your internship time. So during your internship time, you will have a clarity, that you will get a little bit clarity since you're working in all the departments. So you'll have a clarity that whether you like to be in clinical field, whether you like to attend morning OPDs, whether you like to do all the work. And it's not exactly how it is in your head that this is my dream branch, I'm going to be a surgeon, I'm going to be a medicine person, that the gowns, the lab coats, that and the authority that comes very late. But the tedious nature of work, the burden, no personal life, no work-life balance, that comes for that hit first. So sometimes even if it is your dream branch, you need to work in that branch, and then you will get that clarity. So that clarity you mostly get during your internship. So during your internship, you work in most of the departments, or at least that much clarity you will get whether you want to be in that clinical setup or not, whether you want to attend all those morning OPDs, whether you want to be burdened with all those the workload, whether you want to wake up early morning, run towards the ward, take all the rounds, answer to the the consultants, whether you want to do that or not, that you will definitely get during your internship. So first step is clear. We have talked about whether you want a clinical or non-clinical. Suppose you decide that you're clear in your head that you want to do a clinical subject, okay? Now in clinical branch, we have options, okay? We have options. We have medicine, we have surgery, and we have OBG. Okay, I'll come to other fields also, but let's just focus on the main three: medicine, surgery, and OBG. Okay, now certain people, when they have clinical, they're obviously mostly inclined towards medicine or surgery, major two towers of the PG counseling. Okay, so obviously you need a very good rank to get into this field. We'll talk about all these fields separately. Now when it comes to medicine, so medicine is going to be very hectic, and if you are someone who already has that taste for medicine, you want a non-surgical branch, then medicine will be your first option. But remember, medicine is going to be very hectic. Those 3 years of your resident life, PG life, are not going to be yours. You have to completely dedicate yourself towards this residentship. You cannot expect work-life balance, you cannot expect some family time, you cannot expect time for your hobbies. No, you have to completely dedicate yourself. I know certain residents who had to run in the morning always. They don't even have time to take bath. They're always awake at night. So that's the kind of life you should be prepared. So if you're prepared for that, then only take for medicine. Remember, I tell you, having a dream branch in your head is different than when you go and actually work there. That is something different. Okay, now if you're okay with that still, and you want that medicine patient interaction, you want that job satisfaction, very well, we have medicine is ticked. Okay, medicine is ticked. Next is, if you're not inclined towards medical fields and you want the cutting, then you come to surgery. Okay, surgery. Now surgery, you obviously get cutting experience. You get that a surgeon that is also considered as a high status among society, and you see all that film and all, so proper doctor wala feeling. So that you want, you come in surgery. And if you are someone who has interest in cutting or operating, you have always been inclined towards that, surgery will be your choice. Remember, as I had said, like medicine, this is also going to be a very hectic branch. Surgery is very hectic. You cannot expect personal time or work-life balance in those 3 years. And even after that, okay, even for medicine and surgery both, these are not end branches, so you might have to do super specialization. Okay, so inclined towards cutting, you're inclined towards operating. But remember, if you are someone who can't handle bad wounds, ulcers and all, and trust me, in reality, when you go to the ward, that they can get very bad, the gangrenes and all, so the bad smelling, foul smelling, and etc. So if you have to be prepared for that. And surgery, when it comes to surgery, when you're joining residency, you have to remember that you will be doing ward full of dressings every day. Sometimes you might have to do multiple times of the day, and you cannot expect that I won't be doing that, or you won't be getting to do that and complete your residency. That won't happen. You will be starting as the base pillar, that is the first year resident. You'll be burdened with everything. You'll have to check all the dressings. You will have to prepare patients for OT. So everything is there. So that part you have to remember. So you have to be prepared for no work life balance, no personal time. This dressings is something you have to be prepared for. Okay. So now surgery, if you're okay with that, and remember one thing with surgery, just being not enough, you will have to do super specialization to improve your CV. Okay. So that is that. So surgery is also done. Now we come to OBG. Okay. So OBG it can be considered as the end branch. It is a very good branch, evergreen branch, but the only problem with it is there is a lot of legal stuff associated with the patients. That is the mothers, the relatives are always hyper. So you need to be able to calm them down. So if you are someone who can handle a lot of pressure from patients, relatives and all that, then you can go for that field. This field is a very good field, evergreen field. Even after doing just OBG, you can still earn very good. The problem with this is a high pressure branch, a lot of pressure from the relatives, a lot of legal stuff. So you have to be prepared for that. Okay, so OBG is that. And often there is a rumor that OBG is associated with very toxic department. So you have to keep that in mind, especially if you're a guy. OBG is mostly considered as a field related or favorable towards women. So if you are a guy, so that also you have to be consider in your head. Okay. Now pediatrics. Okay. Fourth one is pediatrics. One of pediatrics is also a very good branch, end branch. And even after doing just pediatrics, you will be fine. But the whole point is MD pediatrics, as I said about OBG, these patients are babies. It's a highly sensitive field. You might get called at any time of the night, so you have to be prepared for that. And since it's a babies, parents are always hyper. Even the small things which seem normal for the adults, for babies, they are high risk. So patients will be always hyper. You have to always be able to calm them down. So even if you like babies, it's not the same treating the babies. Liking the babies and treating the babies is something different. Of course, you will have to have some liking towards the baby. Otherwise, you can't handle pediatrics, right? So you have to remember pediatrics, highly sensitive field. You have to be prepared for call at any time of the night or day, and highly hyper patient. You will have to be able to calm them down, and you will have to be obviously good with the babies and calming down, etc. Okay. So pediatrics is also down. We have covered the major branches, that is medicine, surgery, OBG and pediatrics. So these are the major clinical branches done well. The common thing among this is they are hectic as hell. So you can't expect any personal or work-life balance or any personal time. You have to dedicate your all 3 years for these branches. Okay, so that you have to keep in mind. Only after considering this fact, even if you're still here and you're still interested in branches or these branches, then only choose this. Now a little less hectic, but little less. I said, I didn't say they're not hectic. They're little less compared to the top, this initial branches. Okay, so we'll still in the clinical field. In the clinical side, we now have dermatology, we have ENT, we have ophthalm, and we have anesthesia. Okay, so anesthesia I'm going to talk about last, because it is also one of the most sought out field by counseling, and I get a lot of questions about anesthesia. So let's just start. Dermatology, obviously people have liking towards dermatology. Dermatology is always finishes in the top rank. Most of the people won't have difficulty in choosing. Dermatology is little less hectic, very clean branch. You get good work-life balance, but the only problem is after you complete dermatology, if you want to go into the surgical part and all that, you will need good apparatus for that, and that might be little bit costly, and you might have to do some more courses for that. But dermatology is a very good branch, and high earning potential is also there. So that's it. I won't go much into it. It's less hectic, good work-life balance. Okay. Then when it comes to ENT and ophthalm, these are the two branches well sought in clinical side, where people want some kind of work-life balance, but these fields are still hectic. Okay. How to differentiate between ENT and ophthalm? You obviously need to have some liking, but if you don't, you're still confused what is ENT, you need to be prepared to ENT has a lot of blood work. That can be a lot of splashes of blood. While doing tracheostomy and all, you will be roaming all night for casualty calls and all that. That is obviously true ENT and ophthalm, but mostly ENT will be having a lot of ear trauma, and you'll have to do all that resuscitation. You'll have to do, the tracheostomy and all that. So that part you'll be able to, you should be able to handle a lot of blood, sometimes spillage blood on you and all that. So a little bit, I can call a bit complex. So if you are prepared for that, then only go for ENT. Okay. Ophthalm as compared to ENT is a bit more cleaner. That is like less involvement of blood. You want something like that, then you can go for ophthalm. But even with ophthalm, doing a general practice with ophthalm is since a bit difficult. So you might have to do fellowships or specialization in retinal surgeries and all. And after that, you might have to join some hospital to have a good earning. Better to have your own hospital. Obviously, it's not even be possible for everyone, but yeah, you'll have to join some hospital to get good pay. So better with ENT and ophthalm, very good branches with little less hectic. I said little. I'm always saying on the fact that these are very stressful branches, clinical branches in general. Okay, but these are just less compared to the top branches which I explained. Now, when it comes to anesthesia, I'm coming to anesthesia because anesthesia it falls in that middle range where people some very confused whether to take or not. The problem with anesthesia, sometimes people confuse it being chill branch. It is not a chill branch. It is a very hectic branch, and you have to always be in OT or in ICU. Both of them are very stressful environments. In ICU and all, you will have to be prepared for that dull environment, that sound of the ventilators, etc. So you'll have to be prepared for. You'll also have to spend a lot of time in OT. Okay, so you'll have to be prepared for them. It's a very dull environment to sit there all the time. So it can be a bit depressing, but it is definitely very hectic, very stressful. Also, one disadvantage of anesthesia is sometimes people experience lack of the job satisfaction because they are not able to operate, though they spend so much equal amount of time then they see surgeons operating in front of them. So sometimes there can be lack of job satisfaction. That's the only complaint with anesthesia, but definitely it's a very hectic branch. So if you are prepared for that, don't confuse it with the chill branch that I'm not doing clinical branch, so I take anesthesia. I'm not doing the medicine surgery, so I take anesthesia. Don't do that. Okay, it is also very hectic. Be prepared for ICU and OT environment. Also, after doing anesthesia, job thing will be mostly you'll be called for surgeries here and there. So he'll be on call most of the times with different hospitals or different OT environments to handle surgeries. Okay, now we are completed about clinical branch. Because we have psychiatry also in that, but psychiatry and forensic medicine are two different branches. They're very sensitive branches, so I'll explain about them, or we'll talk about them at the end of the video. Okay, now we'll come to paraclinical branches. Paraclinical branch of pathology, pharmacology, PSM, and of course forensic medicine. At last I'll talk about that. So let's start with pathology. Pathology is a very good branch. It's a very good work-life balance. Remember this, paraclinical branches can give you a very good work-life balance. So that is the main key frame. But only thing is you'll lack doctor-patient interaction. If you want that, that is the only thing you lack. But only you will still get that in PSM, but to a lesser extent. But yeah, so pathology, you have to be prepared with being able to look into microscope all the time. You have to be able to look at the slides, and you'll definitely have night shifts also. So you'll have to be working in blood banks. So you'll be sitting at one place. If you have back problems, you have neck problems, if you have side problems, then this field can be a bit difficult for you. Of course, after completing, there's a very high earning potential. You can always work in lab, can be a very good life. Okay, so but you have to consider these points that you need to be constantly looking into microscope. You should be able to look into slides. So that can be the main deciding factor when it comes to pathology. Okay, pathology we are done, very good field. Next comes pharmacology. Pharmacology, one of the main complaints is there's lack of patient-doctor interactions. But otherwise, pharmacology also has a lot of different varieties you can go about. You can work in pharmaceuticals. You can go into teaching. Of course, you can, on all these paraclinical branches, you can definitely go in teaching. Teaching can be one career perspective. Pharmacology can be pharmaceuticals, teaching, or then other things like programs, pharmacovigilance, etc. You can go for. Definitely a very good branch. I myself am doing pharmacology and I'm very happy with it. You get a very good work-life balance, and I just completed my MD, completed 3 years of my MD, and I'm very happy with it. Okay, so only thing is, if you're someone looking for patient doctor patient interaction, that is your main factor, then don't go for polyclinical branches. So my phone storage just got full and I had to shoot 2-3 times because I didn't know that it's already stopped. Okay, anyways, we'll continue. When it comes to PSM is also very good paraclinical subject to take, in a fact that you get a good work-life balance, plus you get that patient-doctor interaction. So if you are someone who want comparatively chiller life, but you also want that patient-doctor interaction, that doctor was feeling, and also want to have work in public sector, public health sector, and PSM can be a choice for you. Only thing, after completion of PSM, you need to know where the job prospects are. You might have to move in tier 1 cities where the job prospects are available, or you'll be working in health programs, public sector, and sometimes most of the people they join as MO in health centers, which is bit easier when it comes to you already having done PSM. So with PSM you have to also be good with statistics, research and all that. PSM also has night shift, so that is something you also have to take into account. Also morning OPDs are there. And yeah, so if you're someone who wants a relatively chiller life, but you also want doctor patient interaction and good job prospects, only thing you'll have to be careful about the area. So we are already finished with paraclinical subjects, so we'll come with non-clinical subjects now. We have anatomy, biochemistry and physiology. When it comes to non-clinical subjects, you have to be prepared for job prospects. If in your area, mostly it will be teaching jobs, okay, for anatomy and physiology. Okay, so in your field, if there is a job prospects regarding that, then you can definitely go for anatomy or physiology. But you have to make sure that your area has that demand. When it comes to anatomy, you have to be prepared for handling cadavers and all that. Okay, so we obviously have done in first year, so it should not be a problem, but still just a point to be made. Now anatomy, physiology, job prospects important. Then for biochemistry, definitely you will have night shifts. Anatomy and physiology don't have night shift, they have bit chiller life. Biochemistry, you'll have night shifts. It's kind of hectic for non-clinical subject, but also the advantage is job prospects are there, and definitely work in lab or you have your own lab, so that is going to be a thing, though it is a hectic. So keep that in mind. Biochemistry, night shifts, and it will be a bit hectic. Okay, now we'll come to the last main 2 branches, that is I had told you, psychiatry and forensic medicine. Let's talk about psychiatry first. So psychiatry is one of the field where you need to have the empathy towards patient. Okay, you can't be getting irritated or you can't be getting stressed to yourself. So even when you're handling normal patients also, I mean normally in OPD, it becomes very difficult sometimes to handle all that stress. In psychiatry, the patients are not normal, are mentally disturbed, so you will have to have that patience. You'll have to have that empathy, and only take this branch if you have that empathy or if you have that patience. Otherwise don't go for it even if you get it. Okay, so these are this is like one of the unique branch. If possible, take it in first round if you want to take it, and try it out. If it doesn't suit you, then you can obviously leave it. If you can't leave it, then it becomes a problem. Okay, so psychiatry, you have to be mentally strong, you have to have that empath nature towards patient, and you have to really like that branch. Okay, also there is still stigma about psychiatry in general public. It is mentally ill patients doctor, so that stigma also is there. Now it's there, so you have to be able to cope up with that also. Otherwise it's a very brilliant branch. Even I do like psychiatry very much. Okay, so keep that in mind. Now, when it comes to forensic medicine is also a very unique branch. You can't just take it off a hunch or just because you're getting it, because you have to be handling legal stuff, you have to be handling postmortems and all that is very stressful when it comes to really doing it. And there are night shifts also. You'll be roaming or handling police stuff a lot of times. And for ladies and all, night shifts and all that postmortem and all becomes sometimes difficult. So keep that in mind too. So don't take this branch on a hunch just because you're getting it. You have to be prepared for all these things. Okay, so psychiatry and forensic medicine are very unique branches. Only take it if you really like it. Don't take it on a hunch. Okay. When it comes to clinical branches, I think I forgot one of important branch, that is respiratory medicine. Okay, so respiratory medicine is also one of the very good. You will get the clinical experience, you will get types of benefits which are associated with clinical branches, but you'll definitely have a little bit room to breathe when it compares to medicine or surgery. Those are very hectic. Whereas in respiratory medicine, you will get some breathing space. So though it is still hectic, but still you will get some amount of some relief compared to other branches. Okay, so respiratory medicine is a very good choice if you want to take it. The only problem happens is if you're working in hospital after after completing your PG, that is, then it's a good thing for you. But when it comes to private practice, what happens? The public doesn't really understand the difference between a physician and a respiratory medicine physician. So what happens is sometimes they might not understand that you have the respiratory problem, so you have to go to a respiratory medicine specialist. So they won't be doing that. They will just go to a medicine specialist or general physician. So getting that unique patient towards you might be difficult when it comes to private practice. So you have to keep that in mind. Otherwise, it's a very good field if you're working in hospital, and if you want a little bit of balance when it comes to your PG life, so respiratory medicine can be a very good choice. So one other question which I get asked frequently is whether you should prioritize branch or you should prioritize the college, okay, or the area. Whether you prioritize college or area, it depends on you. If because sometimes the area also becomes very important. You don't really want to leave your area where you're living. That becomes difficult. So that is your personal choice. But when it comes to college and branch, I would suggest always go for branch, because that is something you will carry on for rest of your life, whereas college is something for a short period of time where you have to just learn. So branch comes first priority, then go for college. And also when you go for college, know that it has some level of reputed college, okay. Don't go for college that not reputed. See that they are at least somewhat respectable when it comes to their reputation. So that is that's the only thing I wanted to tell. Otherwise, branch comes first, then comes college. So that is how your priority has to be when you're choosing a PG branch, okay. So with that out of the way, let's just talk about some general principle. When you're choosing a branch, see that you really like that branch, and don't fall for any peer pressure, because that peer pressure, and if you're thinking of flare and all that, that is going to be there only for few days, okay. Remember, you are the one who are going to work there every day, okay. You have to get up even if you're stressed, even if you're sick. You have to get up every morning, go for the rounds and handle all that stress, talk to all the patients, report to your consultant. These are the things that will be done by you every day. And if you don't like that branch, or if you're not really into it, then every second can feel as a day, or every day can feel as a year, okay. So that is how stressful it can become, your PG life. And also remember that PG life in general, all the branches are going to be stressful at some level. So don't expect it to be like I want complete chill thing. And so that's not going to happen. They are stressful at some level. Even nowadays, paraclinical branches are also becoming very stressful because of departmental toxicity and all that stuff. So I think the stress level might be different, but in paraclinical branches you at least get some breather, okay. In clinical branches you might not get that. So remember that you are the one who's working every day, so the choice has to be yours. Because if you take it out of that flare, and if you take it out of some peer pressure, you are definitely gonna regret it later. If because the reality is different when it comes to actually working in the department or actually working in the ward. So that is one thing I want you to remember. Otherwise, I have already given you the map to go about choosing the branch, and I think it should be sufficient for now. And in next video, I'm going to talk about whether you should be taking a drop or not, or when you should be taking a drop, or why should not be taking a drop. Do subscribe to not miss that. And if you have any suggestions for me to make videos regarding any topic, comment and let me know. I'll definitely make videos on that too. I think I've covered like most of the topics in general. So I'll see you in the next. Ta-da.